Hello, my name is Sarah Doctor, and I'm going to be performing the female catheter insertion. Okay, I would first knock on the door, introduce myself, and describe the procedure, what I'll be doing. I would then gather my supplies, make sure my supplies are the right supplies that the doctor's order says. I will ask the patient the two patient identifiers, their name and date of birth, and if I want I can check the wristband. Then I will wash my hands, expose the patient. And then I would do peri-cares and then get the patient in the proper position. Okay, and then I would open my bag. Take the sterile gloves. Over there. I'll take the sterile drape. Throw this away because we don't need it for female. Okay. And then I will put my sterile gloves on. Okay, and then I would fix this so it's in proper position. Okay, and then I would open up my iodine swabs. Open up the lube. And then I would take my sterile box of supplies. Specimen cup, set it aside. Okay, and then I would contaminate my left hand. Oh, first I would test the tube and make sure there's no hole in it, or make sure it inflates properly. About 5 cc's. I see that's inflating, so then I can go ahead, take this plastic off, and just set this back in the box. Okay. And then I would contaminate my left hand to swab it and separate to expose the meatus. Then I would swab from front to back on one side, front to back on the other side, front to back down the middle, and there's that. would take the tip of the catheter and I would lube it, put lube on it about 3 to 4 inches. Okay. I would insert the cath about 3 to 4 inches. And then until I see urine flowing from it. Okay, and then inserted another inch to make sure it's all in there. Okay, and then I would remove my left hand, and I would now, the contaminated hand, I would pinch right there, and then I would pick up my syringe, insert the water, make sure that my patient isn't feeling any pain and have them report if they feel any discomfort. And I would kind of pull back a little bit, make sure it's inserted properly. And then I would take my contaminated hand, I would cup this, throw that away. Okay. And I let go, and I would make sure not to touch the catheter bag. Pull everything out. And I would remove my gloves, and then put new gloves on. And then I would get the cath secure, which we do not currently have. I would place it right about here on the patient and then tape it to this Y part so it's more flexible. And then I would take the bag and attach it to a non-moving part of the bed. And then take the tubing, curl it, place it right there. And cover up the patient. Make sure the patient's comfortable, doesn't feel any pain. And then I'd come back 15 to 30 minutes later and make sure the catheter is draining. And that's